Ladies and gentlemen, we could not be more pleased to have Dr. Nicole Lurie join us as commencement speaker today. Please give her the warmest Minnesota welcome that you can. Dr. Nicole Lurie.
Thank you so much, Dean Finnegan. And first, let me offer my congratulations to all of you as new graduates, and congratulations and a thank you to all of you who've been there to support them in this journey. I've been looking forward to giving this address and, in some sense, to coming home for a while now. I continue to have just wonderful feelings about Minnesota. It's where I raised a family, where my first real job was, and where I learned in the truest sense to be a doctor. In other words, where I first learned to practice public health. I thought I would just share a few experiences and personal lessons learned from this practice in the hope that they might resonate with you, new graduates poised on the cusp of what I hope is something really exciting as you move now from getting a degree to actually using it. When I first came to the Twin Cities, I split my time, as John was alluding to, between clinical medicine at Hennepin County Medical Center and the 15th floor of Phillips Wangenstein in Health Services Research. I'd do clinic in the morning, I'd ride the 16A bus across the river, and be at Health Services Research in the afternoon. I was pretty content. And then one day, maybe 5 or 6 years into this, in a busy clinic, which wasn't different than any other day, a lady walked in, having missed her last 3 or 4 appointments. She had her 6-year-old or a 6-year-old in tow, and her blood pressure was dangerously high. My first thought was, oh my gosh, she showed up and I need to get out of here. And I took a deep breath and I went in and I said, so what's up? And she said, well, my daughter is incarcerated in Chicago for cocaine. And I have my 6-year-old grandson with me, and he's been having asthma attacks every night, and so I'm spending every night in the children's hospital emergency room, and I ran out of medicine. I haven't been able to get it filled, and I haven't been able to make any of my appointments, and sorry, but I finally made it. Hope you don't mind if I brought him with me. I took a deep breath. Technically, it was easy to know what to do, to bring her blood pressure down, to write her a prescription, to take the kid down to the pediatrics clinic, sign him up for Minnesota Care, and get his asthma treated. And I went to write my note, and I was totally paralyzed. I don't know what it was about this patient, but I was totally paralyzed, and I sat there and said, I can't do this anymore. My patients can't get better until my community gets better. And I need to understand what it means to be a doctor for my community. Fortunately, not long after that, I met Commissioner Malcolm, and we've been good friends since then. But she had a profound influence on my life and my thinking. I changed about everything I did in terms of my research, my collaborations, my partnerships. And I learned so much along the way. Finally, as you heard from Dean Finnegan, I had the opportunity to serve as a doctor for my country. But truthfully, what I learned here was foundational to my success on a national level. Public health isn't just about the discipline of your degree, Epi, Biostats, M.S.P.H, occupational health, health services. It's about all of it, and it's about how you leverage what you've learned along the way into a way of thinking, a way of learning, a way of doing that solves problems for your community, your state, your nation, and in some cases for the planet. In public health, like in medicine, we understand a lot about what makes our patients sick and about the factors that create health. It's what you've all been learning, I hope, although probably it's harder to help a population change its behavior than it is an individual patient. So what can I share with you about practicing public health? I'll try to boil it down to a couple things. Number one, it's okay to have strong beliefs, but be open to the fact you might be wrong. It's a lesson that might be particularly important to learn and digest in our polarized environment today. Both here and elsewhere I've worked in public health, I've worked with some people that have pretty strong beliefs. In fact, I've been known to have a few myself. In my research life, I even went into some studies with pretty strong beliefs and pretty strong priors. When I first came, I had the opportunity to work with John Christensen and Ari Moscovici on a study about Medicaid managed care for chronically mentally ill and aging populations. I was pretty convinced that this was a terrible idea, that Medicaid managed care was bad for you. And you know what? I proved myself wrong, and I had to change my priors. Same thing happened in some work I did with Dean Finnegan. I had to change my mind. What distinguishes you as a public health practitioner, I hope, is not that you have strong beliefs, but that you use the best available evidence to do your work and that you change your mind if the data prove you wrong. So number one, be open to the fact that you could be wrong. One of the wonderful opportunities I had here was to work on data collection and analysis that went into creating Minnesota Care. Those of you who are here way back when will remember that we crafted a bill. It passed both houses of the legislature, but there was an election, and a newly elected Republican governor vetoed the bill. In public health, you don't give up very easily, and so we got to work. We did some more analysis. Advocates got to work putting a face on the problem. I also did some analysis, and not wanting to take anybody by surprise, I went to work and shared that information with the newly appointed Republican Health Commissioner, Mary Jo O'Brien. We started talking about possible solutions. And before we knew it, we were having a pretty big exchange of ideas. And when we got mad, we would start to say, oh, that's a really Republican idea, or that's a really Democratic idea. And we stopped that pretty quick, and we started calling ideas blue and green. Once we called ideas blue and green, we got along just fine. It's usually not about good or bad or about right or wrong. It's really important to work across the spectrum of ideas, and it certainly is essential to working across the aisle, to treating people with respect, and addressing issues of concern for them and finding common ground. It's doable, and it's something that I hope that you will all learn to do. When I set out to learn to be a doctor for my community, I needed to get pretty far outside the university, listen to community groups and community leaders about what was making our community sick. And together we developed a wonderful collaboration between the health plans and the school system around the health of kids. Not time to go into that here, but what I learned was the third bit of advice I have to share with you: to listen to your community. They will help you understand what the issues are and how to solve the problems. And to practice public health, as you heard from Dean Finnegan, you need to be able to build those partnerships and to bring those very diverse stakeholders together to do it. All of these lessons served me really well when I left to work in federal government. And being a doctor for my country was one of the greatest honors that I could have had. People ask me whether you can actually get stuff done in government, and my answer is always a resounding yes. I joke that it's important to have the skills in government to know when someone is telling you something unlikely to be true. That was even before the era of fake news. But you did have to have really good reflexes to know garbage when you saw it. And you also need good reflexes because you know what? That policy window opens all the time. It's usually open for about 10 minutes. And you've either got the reflexes to jump through it or you don't. And you need to be grounded in something real. That grounding, how to think about evidence, something that I learned here from my faculty colleagues across this terrific school and on the street in communities around the Twin Cities. What I hope that you've gotten here in your education in the School of Public Health is the beginning of that education, and also to know that you're not done with that. There's still more to learn. Number 4, in managing disasters, I came to appreciate in a pretty profound way the importance of social capital and social networks. I know you've learned all about that. It wasn't because I finally learned how to use social media. You see, according to the scholar Daniel Aldridge, social networks and social capital turn out to be the biggest determinant for how a community fares after a disaster. And social networks and social capital trump the size and scale of the disaster, the underlying socioeconomic status of the population, how much money gets spent on it, how quickly people respond. It trumps all of that stuff. And he distinguishes between 2 kinds of social capital. He talks about bonding social capital, the social capital that makes a group cohesive, you and your friends, you and your colleagues, you and your fellow students, you and your social network, and then bridging social capital, the kind of social capital that gets you out of that network and connected in disaster space to some kind of effective institution. So why am I telling you about this now? Because you've now become part of an incredible social network. U of M alums, public health graduates, and you've earned both bonding and bridging capital in doing it. So take advantage of it and contribute to it, whether in your friendships, in finding a job, in giving someone a helping hand, and remember to help your communities build it as you practice public health. At the same time, I want to tell you that staying in your network, not hearing from others about what they're doing and how they think, is anathema to the practice of public health. You've got to get out there, meet with, talk with, work with people who are different from you, which brings me to my last kind of lesson learned for the day. When people ask me what the biggest challenge was that I ever had managing disasters, the answer for me is really simple, and it's sometimes surprising. It's not about any given disaster, but it was fighting against groupthink. Especially when people get stressed or are uncertain, it seems that they want to coalesce around a simple, single idea or solution. I expect that the subconscious behavior at play is a little bit like the kinds of heuristics that lead to stereotyping and unconscious bias. But they get these biases around the perceived right answer, and it's very, very difficult to get numerous points of view or solutions to the problem at hand. For me as a leader, I needed to be sure that all points of view were heard, even the unpopular or the wacky ones, and that I was fully cognizant of all the possible course of actions and ways to solve a problem. You can't do that if you just hang in a network of like-minded people. And I couldn't solve problems for my country or my community just by listening to people who think like me. Obviously, you're graduating at a challenging time. Our country is sick. And even though I'm no longer in government, I find I can't abandon my country. Not now. The nature of the work in public health demands that you practice your profession with a kind of civility and respect that almost seems quaint right now, and that you learn, as I did, to work across a spectrum of ideas on both sides of the aisle, that you meet with, work with, interact with, and come to understand people whose ideas are different than yours. And like I might try to convince my patients to give up smoking or my community to raise tobacco taxes, I might try in a similar way to help these people evolve in their thinking. When I was thinking about what to say to you, Dean Finnegan reminded me that I'd be speaking to a group of graduates who will be practicing public health well into the middle of this century. That's kind of awesome to grasp. I think how much has changed about my own career, especially about what we know, the science of public health, the science of medicine, and how we communicate and relate to one another. And I think about what hasn't changed and is unlikely to change, and that's the human condition. Syria and Alexa notwithstanding, people are likely to stay people at least for a while longer, which means that understanding and working with human behavior is essential. The things that make people sick, the things that make communities sick, will continue to do so, and working to promote the conditions that help people be healthy wherever and however you do it, and with the best available evidence that you can generate or muster, will continue to be the practice of our profession. So congratulations to the class of 2018. I wish you all well.